Hello, wonderful students. I'm recording this because this lecture falls on game day and there's usually not quite enough time to get it. Luckily for you on the test, I don't cover a lot of this, or else it's some stuff that's been covered throughout the class already. But the learning outcomes for this activity, this PowerPoint, are to be able to explain or list some common chronic illnesses that in children. So for example, lupus is a chronic illness. We've already talked a lot about it, right? So we're just going back and we're talking about like if there's anything special about nursing care related to kids with chronic illness that maybe we didn't mention before. Also be able to identify categories of chronic illness in children. So as an example, you can have chronic lung disease, chronic kidney disease. Those are types of categories. Describe the nursing role in caring for children with chronic illness. So when you have a child that's chronically ill, a lot of times the nurse acts as a case manager for those families, coordinating care for home oxygen, those kind of things. And also getting the different providers, if they're specialists, if they're not talking to each other, to get them to talk to each other. Assessment, of course, with chronic illness, we've talked about this before, there's family issues going on. There's strain in the family. Maybe there's neglect going on with the siblings, not intentionally, of course, but just the focus is always on the child that's sick. So the nurse, a lot of times in NCLEX style questions, they want you to recognize that the sibling needs attention, or the family needs respite care, or maybe they need counseling because the divorce rate is very high in parents when the child has a chronic illness because of the chronic strain. Also, help prepare the family to take a chronically ill child home. So for example, kids that are born with chronic illnesses, or they get diagnosed later with a chronic illness, the nurse generally coordinates the education for the family. For example, they can't go home without knowing BLS. They are usually taught that they shouldn't have babysitters unless they have BLS. So if there's pumps or oxygen or equipment, they have to spend time knowing how to do that, how to work it, the machinery, and then also they usually do a stayover where the parent practices being in a separate room doing all the care for the child. And then the nurses only come in once if called, or they come in first thing in the morning. Also summarize the nursing management for the child with chronic illnesses, as far as getting them transitioned to adulthood, or possibly getting them into school, coordinating, home school medication, interventions and care that might need to happen in a specialized school setting. Discuss the family's role in care coordination. A nurse often works with the family members to make sure that they feel empowered to ask questions or to question doctors' decisions. So those are some of the things that we want to focus in on for this. So some of the causes of chronic illness in children, of course, we've gone over things like hemophilia, sickle cell, cystic fibrosis, renal tube defects, neural tube defects, neonatal abstinence syndrome, cerebral palsy. All of these I also consider cancer, brain injury from a car accident. All those kind of things are reasons why children might develop a chronic illness or ongoing higher level of care needed. So make sure that you know the definition of a chronic illness is that it's got to be longer than 3 months that they're going to be suffering this. So it's not something like a medication-induced hepatitis situation or mononucleosis. It's something that's going to be usually lifelong that they're dealing with. And you also want to consider the developmental stage where the illness occurs, because let's suppose that the accident happened and they were 6. So generally their neurodevelopment is good up until that age, and then after that, so supposing that they had no brain trauma, but they spent a lot of time in the hospital, they're delayed from that. Or if they had any kind of injury that involves the brain or other cognitive functions, they could have a lower developmental age than they used to have. So you would want to be able to recognize that and help the parents cope with that. Also be aware that there can be some issues where the child, maybe they're not that developmentally delayed as a result of their chronic illness, but they may have social isolation, which is really more difficult on children than it is for adults to be socially isolated. Children really need those interactions. So as caregivers, we want to know, how bad is that? Is the issue that they have visible to strangers? So for example, we had a student here who had polydactyly, I want to say, but she was very good at keeping her hand tucked up under a sleeve of her shirt. And so because of that, nobody really knew that she had any issue, and I didn't even know. So people do that to kind of hide the fact that they're different. Not that they should have to by any means, because we should all accept each other's differences. But imagine the difference between that and somebody who has a issue that's fully visible to everyone, or disfiguring in a way where they might have their self-confidence, self-esteem affected by it. So be aware of the impact that has. When grown-ups have disfigurements, they generally adjust a lot better than do children, because they're still forming their self-image. Also be aware, and this is true with adults too, that a lot of chronic illnesses require the child to be dependent on medication and diets and specialized equipment. So the parents have to know how to use it if they're going to be taking it home, or it could require things like, for example, say trips to the dialysis clinic for a child that has chronic kidney disease. Um, those things are going to take a big toll on the family. Sometimes chronic illness means frequent trips to the ER, or specialists that are involved, for example, pulmonologists when the child has cystic fibrosis. And then there's ongoing treatments also at home that the parents have to learn. So with cystic fibrosis, there's a percussion vest that they have to learn how to use. And usually the child can end up managing their own care. And so that's a goal to focus on too when the child reaches an appropriate age, where they can manage something as easy as putting on a vest and turning on the on button. So we want to make sure that we help the child take over their own care as soon as possible too. Make sure that you observe the parents' interactions with the child to see if they're stressed or frustrated, or if they're having poor interactions with a sibling or their spouse. Those are all things that are important to note so that we can talk to the parents and try to get them the help they need. Note any social adaptation that they're doing, or if they're, how are their parenting behaviors? Are they too permissive? A lot of parents that have children that have chronic health problems tend to neglect their discipline because it feels cruel to them. But we've talked about before, all kids need discipline, and children that have chronic illnesses are no different. They need boundaries and limits. And they really almost start to worry more if you don't give discipline, like it's almost like you're giving up on them. So they can make assumptions about how bad things are based on the parents not treating them the same anymore. When kids are fully disabled, down to the lowest level of being able to be interactive or understand, sometimes there's a tendency for the parents to disengage with the child emotionally. It's a coping mechanism that they develop based on, not wanting to be hurt when the child dies, if they die. So you want to encourage the parents to stay engaged and to try to, you know, deliver, still continue giving the caring and nurturing behaviors that they would normally give. But also when parents are absent, make sure that you provide and tell them when they're at home to provide sensory stimulation for the child. So even if it's just music or mobiles or things that they can touch, you want to keep talking to the child. All of those things are very important for us to do, and also to encourage the parents to do. Like I said, sometimes they really start to disengage, and that's sad to see. One thing that you want to do is when kids do have developmental delays, sometimes they just give up and they don't think that the child can develop any new skills. So one thing that's important is getting them to notice when the child has a capability maybe they weren't aware of. So for example, sometimes speech therapists can come in and work with kids on how to communicate, and then this is something the parent would need to know, so that the parent can get more engaged with the child through and communicate better. Um, you would offer you would assist the parents in offering as many choices as possible. So for example, they may think a child is incapable of putting in a tub or a pool, and maybe that's something that we could work on that family so that they can have those pool times with the child. So provide opportunities for them to practice working on the child's motor and cognitive development so they can be part of the care as well. Care of preschoolers who have chronic illnesses. This is a time where they have a lot of magical thinking, and they might think they caused their own illness, or it's happening as punishment. So you want to recognize that and constantly reinforce that it's not their fault. Also, again, with this age group, they can start to have more serious discipline issues, and this age group really needs to start socializing. So you want to help the family provide that discipline, the social development, and also increase their self-confidence. Always recognize that they need opportunities to play and to achieve goals, because that's the role of, that's the Erickson stage they're in during this age group. So also provide positive feedback when the child, you might notice that the parents are critical of the child if they try to do something and fail, break something maybe, but you want to recognize that and encourage the parents to constantly give positive feedback even when the child's delayed in a certain area or having trouble. School age is more of the same, and school age children start to feel left out if they're former friends now don't want to hang out with them because their friends are doing things that they can't do. So you want to encourage them to keep contact with their friends, and encourage their friends to include them if possible. Kids this age are also starting to be old enough to take over some of their own care, for example, special diets, some procedures they can do on themselves at this point. And you want to encourage that because it promotes a feeling of confidence. The adolescents, we really want them to develop a positive self-concept, because they may start to think that in this age group that they might be single forever. They'll start to think about if it's going to be possible for them to ever have a spouse. You want to encourage them to see themselves as if possible, to be as independent as they can be, so that they can see that they could possibly live on their own without assistance, if that's an option, and help them improve to be develop the maximum amount of skills that we can get for them. Chronic illness, of course, the parents are unusually stressed, and you see that more so than with adult patients where their caregivers are stressed. This is more because the parents are going to see it as a lifelong problem that for them to have to deal with, and they might have guilt or resentment or anger or blame involved. And they're also going to have anticipatory grief because they're losing the opportunity to have the perfect child. And then we talked about how the divorce rate is high. So this is something where we want to encourage them to get respite care so that they can still have dates, for example, so they can still have, mini vacations, those kind of things that can really help sustain the marriage. And then also disaster plans, because imagine, if you have a ventilator dependent child and there's a flood or a fire, so they need to develop those disaster plans so that it doesn't sneak up on them. Of course, we already talked about it, how siblings can have fear, jealousy, embarrassment, resentment, and they can feel lonely. They can, for example, resent if the parent insists on the child taking their disabled sibling with them on all their friend group activities, or they can feel the opposite, like they can want to have their their impaired sibling with them, but other kids don't like it, so they can feel lonely because of that, or they can feel abandoned by their parents, or like nobody understands what they're going through. They can feel guilty for feeling guilty, or it can be complex, and a lot of siblings might need actual therapy to deal with this from medical trauma. It's a specialty area in psychology, and a lot of people need it. The parents might even need it. As far as going home, I already said that you need to make sure the parents are prepared to take care of the child at home, especially if that means learning how to use equipment like ventilators or feeding tubes and things. They need to know CPR. They need to know how to administer the medications. They need to know when to take the child into the emergency room. They also need to learn what kind of things the child could be at high risk for. So, for example, if the child has chronic neutropenia, then what kind of places they should avoid, like public spaces, are usually out. Evaluate the home environment. This is something that bedside nurses don't usually do, but if you were a case worker or a home health care nurse, you would do this. So they need to see if the house needs to be if they need a wheelchair ramp put in, or special shower handles so that they don't fall in the shower, or things like that. So be aware that that is something that you could be asked about. Also consider the burden if the family lives remotely. So suppose they live in Winnemucca, and every time the child has a problem, they have to come all the way to Reno, and they have to stay the night in a motel. So they need access to like the Ronald McDonald House, or the Fisher House, or something like that. Or I know that the hospital sometimes gives out. St. Mary's would give out certificates to use for a free night stay at Circus, for example. So the nurse would want to be aware if they have stuff like that, and also consider the safety of that child if they're living remotely. So they have a higher chance of dying if anything goes wrong with their care. So the family might need to consider moving closer to a hospital if they live out in remote areas, or at least come up with a plan. Of course, the nurse works closely with the case manager, or in some cases, the nurse is the case manager. And so you want to, in that case, you want to find out if they have an education plan, if what kind of family services are going to be available to them in their outlying community. If it's a child that has developmental delays, you would want to be aware of trying to get them set up with early Head Start and other kind of services that are available for kids so that they can get into special education and get all the resources they need. Some kids are so ill that they're not going to be able to attend school, and the family opts to homeschool them. And so that is something to discuss with the family. I was personally aware of one family where the child could go to school. They had cystic fibrosis, but they were absent so much that the school administration accused them of neglecting the child's education, and they accused the family of making it up, that the child actually needed to be hospitalized as often as they were. And sometimes the nurse can be helpful in making those phone calls to administrators and whatnot, especially if you're a case manager or home health nurse. This is not necessarily something you would do as a bedside nurse. All right, so that basically summarizes everything you would need to know from this, and just add it to what you know already about the disease processes, but also consider how questions on these topics might focus on recognition of the families that are experiencing a lot of exhaustion, financial difficulties, sibling issues, and the child's self-esteem issues, transition to care, and those kind of things. Alrighty, have a good weekend. Thanks. Bye.